So for this video, we're going to go over how to use ultrasound for vascular access, as well as a general setup for vascular access. So when you're doing ultrasound guidance, you want to make sure you're in the proper position. You don't want the ultrasound behind you. You really want to be able to look at the patient, look at your ultrasound machine, as well as have access to your kit, as well as being able to push buttons if you need to. So this is the way I like to set it up. The patient, you're at the head of the bed. Make sure you clear out everything from the back. Make sure you have a good table. And you're going to have a central line kit. So this is a triple lumen central line kit, depending on what you need. There's different types of central lines, but in general, a triple lumen is what we use. You want to make sure that you have an ultrasound probe cover, as well as any other sterile things you need, such as a gown, a mask, sterile gloves, sterile gown as well. We're not going to go over all the sterile technique for this video. We're basically going to go over the setup and how to use ultrasound for the guidance itself. But make sure the ultrasound machine is directly next to your table, so you have good access to that. And make sure it's plugged in, because you don't want the ultrasound machine turning off while you are performing the central venous access. So here's your central line kit. This is after it's already been opened and taken out of the box. You're going to see that there's a ChloraPrep usually that's available. And everything inside the kit is going to be sterile. And we don't have sterile gloves here, but I'm just going to use a pair of non-sterile gloves to demonstrate this technique. So I'm going to open this, put on the gloves. Okay, and obviously you want to be gowned with sterile gown, as well as a sterile as well as a mask and a cap. So as part of the central line kit, what you have is, like we talked about, the ChloraPrep. So you want to use your ChloraPrep. Here, you're going to open this up. You're going to break the seal, okay, and make sure that it turns orange. And you're going to prep the patient. So just imagine I prep the patient in terms of the internal jugular vein, and that's all prepped over here. And you want to do a really wide margin all the way around so that you can have a really large sterile field. This is going to be your sterile drape here. And there's a portion that says head right here, so obviously that goes towards the patient's head. So we're going to take off the sticky portion and place it directly where you're going to be cannulating. So here we're going to put it. And make sure, obviously, you want to do this all under sterile technique. Don't touch any blankets or other portions of the patient. Okay, so you see here we have our site is exposed, and this is where we're going to be cannulating. I'm going to move it just a little bit. Okay, so this is our actual procedure kit. So there's a lot of things in here. Some things you need and some things you don't need. Usually this is an extra drape. We usually don't need this. Here's your gauze. And there's a lot of things in here. There's needles, there's guide wires, there's all these syringes, and what do you need and what do you not need? So the first thing I pick up is there's this needle right here. And this needle actually has a catheter on it. We don't really use this needle. In general, some physicians like to use it, but I don't like to use this needle. I actually like to use this other needle. So find the largest needle in the kit. So this is a large needle here. And this is the needle you're going to be using. Let me see that a little bit better here. This is the needle you're going to be using for your initial cannulation. Okay, so I actually take this needle with a guide wire on, because this guide wire, this needle, you have to thread the needle, the catheter in first before you put in the guide wire. Versus this needle, you can just put the guide wire directly inside this needle and it'll fit. Okay, and you can see, but the bevel of the needle, I have it face towards the numbers of the syringe so that I know when the numbers are facing up, the bevel is also facing upwards. So you put that aside here. Here's some lidocaine too. So this is syringe for the lidocaine. Okay, it's a smaller syringe, and you can withdraw that and numb up the patient before you start. Okay. And here's another syringe. I usually use this as a flush. So you have about 30 cc's of normal saline that you can pour in here, and you can use this as a flush after you cannulate. So the other portions of the kit that are important are, here is a triple lumen catheter, and here you can see the actual centimeters. You can see here. So here's the centimeters. Here's 15 centimeters, and every dot above that is 1 centimeter. Okay? And this 2 lines right here indicates 20 centimeters. So that's how you know how far you're going in when you're cannulating. Okay, so you're going to put that aside. Other portion of the kit, here is the dilator. Here, so it's very important, right? So this is one dilators. We'll go over that a little bit. And here's the guide wire. Okay, it's in a plastic sheath, and you want to pull the. So it comes like this, like it looks. It comes like this with a little J curve right there. So you want to pull your the tip of the sheath out so that it's straight, so that when you cannulate, it's straight and you can go through the needle much more easily. Okay, so I want to prep up that guide wire also. Also, there's a scalpel here. Okay, scalpel, and this you just push in or push out and pull in order to open and close that scalpel. All right. Also important things is right here. This is where you can put your sharps when you're not using them. And this one right here, if you put the sharps in here, they get locked in and you can't take it out anymore. Here's some staples that some people use, but I don't recommend using this. It's rarely used. So I'm going to take this out. And these are actual clips that you can help suture your central line onto if it's the catheter is too long. If it's more than about 5 centimeters outside of the patient's skin, that I usually use is just to make sure that it's more secure. All right. So now, in addition, you want to put an ultrasound probe cover into your sterile field. So this should be done actually before you start. So here you can actually have someone put this in for you sterilely. Okay. So we're going to open this up, put the ultrasound probe cover in. And what's in the ultrasound probe cover kit, as we open this up here, so here's the ultrasound probe, and there's multiple different types of ultrasound probe covers. Okay, so this one is a nice one because if you open it up, there's actually a little hand here that shows a sticker, and you literally just put your hand inside here, and there's an arrow where your ultrasound goes into, your probe goes into. So you can have someone hand you the ultrasound probe, and you just grab the ultrasound, right? So imagine someone was handing this to you, and you just grab sterilely on top of that, and you pull the ultrasound probe cover down. Okay. As long as you can, all right? Place it on the bed. And what you'll notice here is that there's a lot of bubbles that go across here. So you want to pull, so I'm pulling the probe cover as tight as possible, and then I use one finger to swipe off all the bubbles. So there's a small amount of gel between the probe cover and the ultrasound. Okay? And there's 2 rubber bands that come in the ultrasound probe cover kit too, as you see here. So I use one rubber band and put it right at the base of the transducer, and another one kind of right where the wire meets the transducer here. Okay? And the reason I do 2 is if you don't put this one here, this is going to slip and it's hard for you to maneuver. But when there's 2, you have a good holding point right here, so you can hold right in between these 2 rubber bands and you'll be really stable. So after you get the ultrasound probe cover on, this is all sterile, so you really want to make sure it doesn't drop anywhere, it doesn't go somewhere else. So I turn it, I twist it, and put it right on top of the patient, assuming they're not moving. And you can put that on top of the patient so it doesn't fall. Another thing that's in your ultrasound probe cover kit is this ultrasound jelly. This is sterile ultrasound jelly, okay? So you can open this, you just twist it open here, and there's some sterile gel here. You put that directly on the patient. You don't need to put too much. This is actually 20 grams. I'm barely putting, there's almost all of it still left in there. I just put a dab on there. So like we talked about before, right? I do a double twist around my arm. And the indicator, remember, is towards your left. Okay, so the indicator is towards my left side over here, or my left side over here, okay? Just to make sure that when I'm on, when I have the needle on the left side of the probe, it also shows up on the left side of the ultrasound screen. And the reason I do a double twist is that this pulls my forearm and not my actual ultrasound probe. Okay, so this is how I'm holding it, twisted around my arm. And from there, I always anchor, so I use one pinky to anchor. And now I'm going to look for the internal jugular vein on this phantom model. So there you see the internal jugular vein. And medial to that is the common carotid artery. So internal jugular vein, compressible, okay, common carotid artery. So internal jugular vein is usually going to be lateral, and common carotid is going to be medial to that. So I'm going to increase my gain. You can have someone adjust the ultrasound settings for you, or if you have some sterile gauze, you can actually put on the ultrasound and adjust your settings manually if you need to. So this is a good depth for this internal jugular vein. And what I want you to do is, after you see the internal jugular vein, don't go cannulating right away. Make sure you map out your vein. So here I'm sliding up and down, making sure I know the angle that I'm going to be cannulating. Conversely, you can also turn 90 degrees and get it in a long axis view. So I turn clockwise 9 degrees, so this is a long axis view. So I know the direction I have to go is this direction, okay? So a lot of people I've seen, they think they have a good internal jugular vein, but their angle is off, even though it looks like a good circle. But when you slide across, you see that it doesn't stay in the middle of the screen. That means that your vessel is actually not centered, correct? So you want to make sure it's centered, and if I'm sliding, it should be in the center of the screen the whole time. That means I am centered, I've centered the vessel, and I know which direction my needle should go. Okay? So from there, I grab my needle. So once again, this is the needle you're going to be using, and the bevel corresponds to the numbers, so it goes up. And how to hold this, I get a lot of questions with this too. So I hold it with 2 fingers like this, okay? So my index and middle finger, and my thumb is the one that pushes the syringe so that you can aspirate, okay? So once again, 2 fingers here, index and middle finger, and here you push with your thumb in order to aspirate, okay? And this gives you the best angle, I feel like, because you can go up and down, left and right. Some people like to use this technique where they hold it like this, but I feel like it's hard to maneuver. You can't really go up on that. You have to really force yourself. So I like this, but you can choose however you want to do it. So, all right. Oh, and of course you've numbed the patient first, right? So using your lidocaine, you numb the area before you actually use the large bore needle. So here, I'm going to increase my gain just a tad, just make sure, okay? So once again, I'm sliding across, making sure that I know the direction of my vessel. My bevel's up, my numbers are up, so I know my bevel is up, okay? And how I start is I actually put the needle, okay, right underneath the ultrasound. And there's a little marking right here you see on the ultrasound, and that corresponds to the center of the ultrasound screen. So that's centered, okay? And I put it right where the dot is. I'm anchored, and I put my needle right underneath the ultrasound. Okay, and you see there's a small hyperechoic area right on top, right in the top of the screen right there. And what I'm doing now is that every time I go in a little bit more with the needle, I fan my probe and I go away from the needle tip. And then now I come back towards the needle tip to make sure I know where the needle tip is. You don't want to get a false sense of knowing where your needle tip is, and you really should be following it. So here I'm going away from my needle. I'm fanning away, and now I'm fanning towards my needle tip, finding it there. Okay. Away and towards. Okay, so I'm going in slowly. You can see the needle tip there. There, and I'm going in more, and then every time I go in, I'm fanning my probe, looking for my needle tip. Don't go in fast. You don't have to go fast for this. You just want to make sure you find your needle tip. So I'm going away. Now I'm going towards my needle tip again. Now I see that where it is. Now I go in, I fan away, and I go towards. Now I see my tip right there. It's at the anterior portion of the vessel. All right. Now I'm still fanning and making sure that I know exactly where my tip is at, and then I go in and I cannulate the vessel right there. And I should get a flash. So here I get a flash, a red flash over there. And I can confirm that I can see exactly where my needle tip is. You see that hyperechoic area right in the middle of the vessel? I know I'm exactly right in the middle of the vessel. So that's what I want you to be able to do, is to be able to guide your needle tip, be able to see it tenting the anterior portion of the vessel, and then seeing exactly where it lies in your vessel itself. Another approach you can use is the long axis approach. I would recommend perfecting the short axis approach first, but if you want to do the long axis approach, you can turn your probe 90 degrees, okay, so clockwise there. And here, once again, you're going to start right at the base of the probe, and you see here, see my needle tip going in, so I can actually follow my tip going in, and there, I'm right inside the vessel itself, and now I'm aspirating fluid. And you can see if I went too posterior, that's the posterior portion of the vessel, you can pull back just a little bit to make sure you're right in the center of that vessel. That's how you're going to make sure that you get the best chance of getting that guide wire through. So once you get that, okay, you notice that I'm going to put my ultrasound probe down, either the short or long axis approach, okay, assuming you got the vessel. You put your ultrasound probe down and hold that right hand really steady, because this is where most people lose their needle. And with two fingers, your index and your thumb, you're going to hold the base of that needle tip and anchor with your pinky on the patient so you don't move. And then slowly twist off this cap here. And get your guide wire, and put it straight through here. I like to use a little gauze here too, just make sure there's no bleeding. So you get your guide wire through, and before you actually do the next step, you should confirm where your guide wire is. So here I can see it. This is a short axis approach here. I can see the guide wire inside the lumen of my vein. A nicer view sometimes is to actually look at it in a long axis view, and you can see here that it's nicely in the vein. So this is a great way to confirm right before you dilate, because once you dilate, the patient can bleed a lot. Okay. So now I've confirmed my guide wire. I know it's in a vein, it's not in the artery itself. Now you can go finish the rest of your central line procedure. So the next step is going to be, you're going to use a scalpel, okay, and you're going to put the ultrasound probe away, and then you're going to make a small nick right at the base of that guide wire. So I'm not going to make a nick on this mannequin, but you can see you just push it in, make a small nick there, close your scalpel there. And then you're going to get your dilator, okay, and you're going to put it through the, and then you're just going to dilate. I'm not going to dilate fully, but you're going to dilate probably about 2/3 of the dilator, and you're going to pull that out, and then put in your central line. Make sure that it's usually the brown one, the brown clave or the cap that the guide wire goes through, and make sure all the other ones are clamped, because if they're not clamped, they might bleed. So clamp it here, and hold on to your guide wire the whole time. Okay, so the guide wire is coming out of the other end, and then you can just thread your catheter directly into the vessel. Okay, and then, so you normally the right IJ, I put in 15 centimeters. So right now it's at about 13. This is as far as it goes for this mannequin. Okay, and then you just pull out your guide wire. Cap this before, because blood sometimes can come out. So you just clamp that clave, and then put on your clave. You're going to flush your lines, suture up, put a tegaderm or put a bile patch on and a tegaderm, and then get an X-ray and confirm the placement. And that's it for the central line.